Joy, loy नहीं. ये मग कंदी तू कंदी तले ना. ते तंचे ये पूरा चेवरी उम चेवरी मुझे आंतो. मग स्क्रीन है ना तंचे. ते कंदी नहीं है ना प्लीज. Mute कर audio. Mute audio.
जोशनी Good evening, all.
Good evening, sir.
Good evening, Dr. Harsh. Dr. Prashant has joined.
सर वो एक दूसरी मीटिंग में है, थोड़ा लेट ज्वाइन करें.
Okay. उसका अभी बाद में है. Yes, I think 16 are there because if we start late, it will become very late, I think. Dear friends, we have come to the third live class of the PERCEPTRON A curriculum. I think fourth one, I think, if I believe. No, third one. So we finished the foundation of artificial intelligence and about generative AI, hands-on training of generative AI. And in Sunday, Dr. Kishan has told you about the safety guidelines of artificial intelligence, consent forms, regulations like DPDP Act, various other regulations like GDPR from European Union, HIPAA guidelines from US. He has touched upon. And now today, we have a very important class. So this is supposed to be the, most of the pediatrician, when I took the WhatsApp poll, you people want to adopt AI in your clinical practice or hospital. So probably this is a very, very important part of the curriculum. For this, we have eminent AI faculties from our pediatricians only. They are all very much AI enabled and they are using day by day since last 2 to 3 years. And they are into the teaching of AI to the pediatricians and other doctors all over the country. They are all very dynamic. I will happy to introduce Dr. BHAYANA. He is a consultant pediatrician from Hisar, Haryana. And he has done his MD from the Premium Institute, Chandigarh, Bijmat, Chandigarh. And he is running a Sonakshi IVF care center. 2 centers he is running. So he has a very vast experience regarding adoption of AI in his hospital. See, that is what he preaches and he teaches. So he is going to tell you about AI-powered documentation in OP and IPD. So he is going to give you the contextual theory and following which a demonstration, hands-on demonstration, please make use of it. Along with Dr. Harsh, we have another eminent AI-enabled pediatrician, Dr. PRASHNT KARIYA. Most of you know about him. He is from Surat. He is into the artificial intelligence and as well as the adolescent. So I welcome both the speakers on behalf of Smart Hill Nexus Academy. So the next 2 hours will be both of you. I will make Dr. Harsh as a host because I'm not feeling well for last 3-4 days. I'm take a little bit rest, but I'll be in the meeting only. So please make use of these 2 hours. And also I have given the assignment of last 2 modules. So take your time, another 5 days, 7 days. You may use the AI tools, whatever you want. You finish it and send to the, better will be the email, smarthillexus@gmail.com. I will send in the WhatsApp link. And you people are really doing a lot of creative jobs, because today I saw Dr. Ria and others. I could not able to remember the names. The posters you have created, infographic on PERCEPTRON. It's a heart of the deep learning. PERCEPTRON is the heart of the deep learning. It makes a lot of sense that you people are really interested into this AI. So it helps you to teach you. I think all of you should become like a thinker and researcher and always be skeptical whatever you learn, and you try to dig more and more till you reach the goal. I think I don't take much time. I hand over this stage to Dr. Harsh. Harsh, I will make you as a host. Already you are sharing the screen.
Yes, sir. Thank you, sir. Thank you for the kind introduction.
Yeah.
And
the screen is visible. Your voice is also good.
Okay, thank you.
Already 20 people are there, Harsh. Many people will join. Okay. Please start.
If I can see their faces, that will be great. If can't, it's okay. So basically,
the recordings are there, Harsh. Sorry. Recordings is in my cloud. Okay. Don't worry about recording. All this is ready. So please start your session.
Thank you. Thank you, sir. First of all, thank you for the kind words. Myself, Dr. Harsh. I'm a pediatrician working for last almost 20 years now in the field of pediatrics. And today, what I'll be showing, I'm already using in my OPDs, in my IPDs. I will not be showing anything which is just a theory. Okay, this is my promise to you. And you can interrupt me anytime. It's not that discussion is at the end. Discussion is continuous discussion only.
28 हफ्ते का हमारे पास आया था कि
I think something wrong. Okay. So, how many of you love your profession? If you can show your face, it's okay. Otherwise, at least thumbs up, message, something like that. How many of you love your profession? Okay, great. And how many of you love this documentation part? Okay, only one. And manual documentation, how many you like? Okay, you like it, great. Then it makes my job, I don't think how much it is worth of. But how many of you spend more time in documentation rather than talking to your patients? Okay, Dr. Pradeep used to spend more time in documentation only. Anybody else?
both
Both. Okay. So, okay, great. And why documentation is important? Because everybody is loving documentation. So I believe everybody knows that without documentation, we cannot accept continuity of care. We cannot accept patient safety because we are not computers ki sab kuch yaad rahega. Many medical errors are known to happen. And today, one sentence every doctor knows: if it is not documented, it is not done. So that is the importance of documentation, collaboration of teams, and you gather data for improving your practice only. So we cannot stop documenting. Okay, even if you wish to, still you cannot stop documenting, but it is a part of practicing medicine. Okay, no doctor hate documentation, but the main part is it adds up to the cognitive load. Every time you have to think, इतना सारा पेशेंट देखना है, इतना सारा डिसीजन लेना है, and documentation adds to your cognitive load. it steals your time. There was an article which has shown that where actually a neonatal pediatrician, a neonatologist is spending his day. So that study had shown that over last 8 to 10 years, the time in documentation is gradually going up. The time you are spending directly with the patient is almost same, and the documentation time is steadily going up because of all the regulatory compliances, because all of the legal compliances. You have to do it. There is no other way out. So can I ask you a question? How many of you finish your OPD on time? At 5 if you have thought OPD finishes. And how many complete IPD notes daily? And how many of you remember every discussion with every patient? Most of the time not. What we aspired for this thing, we wanted to be a doctor for, we wanted to listen. There is no doubt, we all are doctors. We want to diagnose, we want to treat, we want to build. But everybody wants from us, if we are doing a job, they want complete notes, they want detailed record, all the compliances to be over, coding, billing, legal protection, reporting, everything we have to do. And this creates a heavy burden. And actually it's a, I don't know, I should say it a thief or demon or rakshas, kya bolna hai. Every time he's standing behind you. Whenever you are seeing your patient, the documentation part needs to be completed. ये चाहे हो ना हो, ये पूरा होना चाहिए. This is the thing today. And when after doing all the genuine efforts, everybody is doing, I am sure, whenever there is an audit, NABH audit or something like that, anytime you don't have any incomplete discharge summaries or informed consent or hand hygiene, every time do you complete your documentation when you are being audited? Dr. Pradeep, are you able to do this?
Sometimes we do not.
Sometimes, but I am most of the time we are lacking what is ideal. In spite of we are doing best from our side. If I give you a method which stops stealing your time and bypassing cognitive overload, would you like to have it?
Yes.
Obviously. बेकार का सवाल है. But would not that change the way you practice medicine? अगर सिर्फ आपका documentation हटा दिया जाए, and I say that it will be taken care of, you just take care of the patient. The way you practice medicine, it will change. And more than that, we can standardize the things. Most of the time what happens कि अब मेरा मूड अच्छा है तो मेरे नोट्स बहुत अच्छे हैं, शाम तक मेरे नोट्स क्या हो जाते हैं? First patient you start taking round, you write respiration, then hemodynamics, then feeding, and then all that. And on the 10th patient, vital stable, abdominal NAD, respiratory NAD, plan, continue same treatment. Is it happening with you also, or it's me only? Everybody feels like this. So there is no standardization. How we can do standardization, how we can save our time, how we can avoid this cognitive load which documentation puts on our head. This is the main idea of this talk. Okay, so AI is the one which can make this dream a reality. Actually, this was my dream 10 years back कि कोई हो मेरी documentation कर दे, मैं बोलूं और सब कुछ लिखा हुआ आ जाए. And this is happening with me for last 1 year. But we have to strategically align AI. It's not a software. Most of the time when I give a talk at any place, everybody asks, sir कोई अच्छा AI based EMR बता दो जिसमें मुझे कुछ करना ना पड़े. But to your surprise, there is no such AI software. You have to understand AI, then understand your workflow and strategically align all those features in your workflow so that you can use it for your betterment. It's not a software. Okay, so AI is not actually a technology, one technology, rather it's a combination of different technologies. If I talk only of AI for the OPD part, it has one layer of speech recognition कि आप बोल रहे हैं कोई उसको सुन रहा है and that is being transcribed immediately. Then there is layer 2 which is known as natural language processing. All those things which were heard by that speech recognition device that will be changed into a humanic language. Then the medical knowledge context, how to, like a Google used to be a only thing. Now this AI layer will understand that language with context of that medical knowledge, and this is generative AI which draft a notes. What we think chat GPT is AI, but there is below this there are many layers of AI also, and documentation use all these technologies simultaneously to be actually fruitful in our workflow. Each component of AI gives AI its unique superpower. You know what are the powers of AI? It can listen, it can capture your conversation. You can say that, okay, there are mic speakers also which can listen to you, but AI enabled mics or speakers or those devices, those interpret what you want to say. This is the difference from a routine mic and speaker. They understand, they interpret the clinical meaning. What does that mean? Suppose you are saying gravida 3 life 0 or abortion 1, it will automatically understand that we are talking about a obstetrical case history and we are talking about a third pregnancy and with 0 life. This it can interpret with the help of natural language processing. Then it can write also. You don't need to type. It understand your words in the form of mathematics and reply in the form of mathematics. Organize the things in a way which is required, then summarize the thing, then checks the things. All are these powers which we use in documentation. So whenever we want to use AI, before understanding AI, you understand your workflow. In OPD, how the patient register, then check in OPD, then provider's room, patient admitted, lab test, or a big hospital, how the patient goes where, and we can decide which AI specialty I am using at this or some other place. So AI is not a single software कि आप उसको लेके बैठ जाएंगे. It's a part of a workflow. It starts with any one task. When you want to use AI in your workflow, you can start with any task. Don't try कि मैं सब कुछ AI से कर लूंगा. It is not going to happen. You start with one task which take maximum of your time and you hate the most but cannot skip. Can you tell me any task which is like this for you in OPD, IPD? ऐसा कौन सा काम है आज जो आप नहीं करना चाहते फिर भी करना पड़ता है? Discharge summaries, IPD notes, OPD notes, whatever. What do you want?
I'm giving instruction here. मेरे पास
Okay, now for me, the most difficult part was IPD notes. I have 20 babies admitted in my NICU. If I have to put notes for single baby as per NABH requirement, how much time it will take? What do you say?
Daily notes is it's about 4 or 5 minutes.
4 or 5 minutes. And if you have 20 babies, how much time it will take?
1 hour.
1 hour. 1 hour 20 into 5 translates into almost 100 minutes, 1.5 hours, and you have to put it 3 times. So almost 3 hours of your daily time, your productive time will be used in putting notes. So I am giving you an example how I can put the same notes, better quality in 5 seconds. So this is a custom GPT which we will show you how to create for yourself. I am showing you the example how it works. I just take I just take this mobile during my round and I just speak into it like this.
बस एक 28 वीक का बच्चा है, आज तीसरा दिन है, कल आया है वेंटिलेटर पे। अभी उसकी सेटिंग्स 14/4 है, FiO2 40% चल रही है, 2 ml फीड शुरू किया है, इको किया था, उसमें 1 mm का पीडीए है, एब्डोमेन सॉफ्ट है, यूरिन पास कर लिया है। इसके नोट्स डाल दो प्लीज।
So what I have told this in my mobile कि मेरे पास 28 वीक का बच्चा है। Intentionally I am not speaking into English with English because my MOs who are not good in English, my staff who is not good in English can speak their local language कि मेरे पास एक 28 वीक का बच्चा, आज तीसरा दिन है, कल आया था वेंटिलेटर पे, ये सेटिंग है। So how much time do you think it will take? 2 minutes, 5 minutes, 10 seconds? Just speaking per patient. Phone is like this. Yes, please.
10 seconds.
10 seconds. Okay. And just in 10 seconds, I'll just click it like this. I've just clicked it. That's it. इससे ज्यादा मैंने कुछ नहीं किया. And within next 20 seconds, all the notes are ready. See. Can you see what I have written? 28 week का बच्चा है. Patient detail 28 weeks preterm infant day 3. आज तीसरा दिन है. Extreme prematurity, mechanical ventilation, 1 mm का PDA मैंने लिखा है. PDA 1 mm on echocardiography. If you have to type these kind of notes, it will take at least 10 minutes. But here it is taking only 20 seconds. For one child, I have put notes. Now I can copy from here and paste it into my EMR. Now 20 babies, 20 seconds per baby, and all notes are done in less than 20 minutes. How many of you would like to have this assistant in your NICU, PICU, wherever you are working? You would like to have, so you have to create it as per your need. I am not saying that notes will be in this format. You can have notes ki CNS. If I have not talked about CNS, you should be silent. But what I wish, in my notes CNS should be within normal limits. How to create that? This is a custom GPT. Okay, how to create, I will show you. So this is the first challenge I used to have in my NICU. Any more challenges you tell me, I'll show the solution for it. Then I'll tell you how to make it. Any more challenges, sir?
But sir, how to put this copies and just put it in the EMR? EMR always come with some boxes.
Okay, I'll just show you how to put into EMR. My screen is visible?
Yes.
So this is my custom GPTs. Anybody wants to speak? I'll put up fresh notes. अगर आप बोलना चाहते हैं कुछ भी बोलो, अभी डल जाएंगे. Please speak, anyone in your language. Okay, I'll speak only. I have a 24-week baby. Today is day 6 of life. Child was on ventilator, and today we have put it on NIPPV. Echo was done. PDA is closed. Child is currently on meropenem and vancomycin. Feed started 2 ml. So it took me 10 seconds to speak this. Everything is come written, and that's it. So all these notes are already written. See, 24 weeks I had written. Today is day 6. It has extreme prematurity, respiratory distress requiring support, current vital normal, extubated, NIPP. All these information I have given like this. So now what I'll do, I'll just copy from here and then open my EMR. This is my EMR. So if I have to keep it into the baby of puja, these are progress notes. This is my new progress note. This is control V. That's it. All my notes are here only. Dr. Sheikh Ahmed, you want to ask something?
सर गुड इवनिंग। ये सर आप जो वॉइस से कन्वर्ट हो रहा है तो इसका फॉर्मेट प्री फॉर्म्ड है या हमको बनाना पड़ेगा सर?
Sir, I like this format. If you want to change this format, you can edit your GPT and put up instruction in the way you wish to have. All these things I have given to it कि मेरे को ऐसा चाहिए, एक्सपेक्टेड पेशेंट में पहले डिटेल चाहिए, फिर टाइम स्टैम्प चाहिए, डायग्नोसिस चाहिए, बट इफ यू वांट इन सम अदर वे you can have that thing also.
How to go to custom GPT?
Dr. Prashant will be telling you in next 1 hour, but I'll just sensitizing you ki what all we can do with all these things, how to create, what is the possibilities. Okay. Okay, tell me any another use case. I'll practically demonstrate you right now जो आपको करना पड़ता है but आप करना नहीं चाहते. Tell me anything.
Discharge
Patient
summary.
execution.
You had discharge summary.
So let me speak, then we'll try to have it, sir.
Let me.
I mean, can I make a like voice recorder, then we have the discharge summary?
Okay. For the discharge summary, what I used to do, suppose you want to put up notes first. Sir, speak up. आप बोलिए एक बार.
जी. I have a child who is 3 years old, female child, around 16 kg, presented with history of one-day rash, starting from the lower limb, spreading to all over body gradually. No history of fever, no history of other bleeding manifestation, no joint pain. And she came to us, we investigated. Her platelet count was around 12,000. Rest of the investigations were within normal limit. We started on 0.8 gram per kg of IVIG. Her repeat platelet was 77,000 after 72 hours. We got her bone marrow done, which is negative for other conditions like.
सर एक मिनट, ये माइक का प्रॉब्लम है, या तो ये सुनता है या लेता है. सो मैं बिकॉज इट इज 3-year-old चाइल्ड. आप बोलते जाइए, मैं बोलता जाऊंगा इधर से. 3-year-old चाइल्ड.
3-year-old female child.
3-year-old female child.
Presented with acute onset rashes, both lower limb.
Presented with acute onset rash, lower limb.
Ascending to all over body over 1 day.
Then ascending to all over the body.
1 day.
Went for last 1 day.
1 day. Involving the gum bleeding and bleeding spot on the eye.
Now having bleeding spots in the eyes and bleeding from the gums.
Bleeding.
Okay. So what I was saying, it is speaking 3-year-old female child presented with acute onset rash, and I specifically tell you this custom GPT is designed for NICU because I run NICU. But still, let's see how it makes. So these are the notes it has made. 3-year female, acute onset rash over limbs for last 1 day, bleeding in both eyes, bleeding from gums. Are you okay, sir, with this?
I think fair enough.
So these things can be generated just with 10 seconds of speaking into the phone. That's it. Okay. Then next person. Yes, sir, please.
Once we make this particular draft,
Yes, sir.
edit it subsequently, like addition of some more investigations and all.
Yeah, plan it as written. See, admit for close monitoring. I have given a knowledge base to it कि अगर ऐसी information होती है, so I have uploaded a protocols of my hospital and PGI protocols. From that, it will make us assessment also suspected ITP, and then it will give a plan also. See, you can see that. हमने ये ऐसा कुछ बोला नहीं था, but ये
जी
इंटेलिजेंट है और इसने खुद कर लिया ये.
तो सर ये डेली नोट्स में आएगा या इसको हम लोग एक वी कैन मेक अ डिस्चार्ज आई मीन वी कैन कस्टमाइज व्हाटएवर वे वी वांट वेदर इट इज डेली नोट्स और
What?
डिस्चार्ज व्हाटएवर
Whatever you want. If you want a discharge summary now, this is what you are saying.
यस सर
Okay. Now, when I have to make discharge summary, there is a separate custom GPT for me like this. In this is pediatric discharge summary, and this is for the NICU course during stay I used to make. So I generally make it like this कि मैं उसका कोर्स लिखता हूँ, हिस्ट्री शुरू में लिख देता हूँ. So I'll download all the notes which I have gathered during my, suppose I have a baby, there is a baby named baby of Chand. Okay, all the progress notes, these are her progress notes. We are putting 3 times a day, and I'll show you. This is a important step. See, no header and direct header, because you cannot upload any notes with patient identification on a AI tool. So I have specifically requested my EMR vendor that I don't want any header. Header means patient का identification नहीं होना चाहिए. See how these notes are coming now. There is no name of the baby, but all these notes are coming up. Okay. Now I will just download it from here, store it, and then I will upload into my course during state discharge summary. So these are my Chand notes. I have uploaded. My notes are done. Everything, every information was documented into it. What happens when you are in C? It has read all the notes and gave a beautiful course during first. It has explained respiratory कि ऐसे ऐसे था. डे 5 पे मैंने बबल सीपैप किया था, NIPPV पे डे 8 पे डाला था, ऑक्सीजन डे 9 पे दिया था, फिर हीमोडायनामिक्स कैसा था, अदर सिस्टम कैसे थे, जोंडिस, न्यूट्रिशन. I have given the instruction that I want my summary in this format. You can have in any different format. Whatever you wish to have, you have to just edit here कि मैं क्या चाहता हूं. जैसे मैंने आपको दिखाया इंस्ट्रक्शन यहाँ पे देना है, how to I want in this structure, but you can change this structure by simply typing कि मेरे को तो ये नहीं चाहिए. I hope I am clear.
तो इसका मतलब है जो हम स्ट्रक्चर बना रहे हैं एक प्रकार का प्रॉम्प्ट है जो बैकएंड में काम करेगा.
Yeah, this is the custom prompt only. Okay. प्लीज स्विच ऑन योर कैमरा. ऐसे मतलब मुझे लगता है मैं किससे बात कर रहा हूँ. एनी क्वेश्चन प्लीज आस्क. anyone or I will go further. Anybody wants to ask something? I'll see chat box.
सर हाँ यस सर.
Yes sir, please. So in this way, basically you have to identify your workflow first. Okay, it is not a software.
The consent.
Okay, consent means
कैसे करेंगे सर इसका?
Okay, consent means you want to have जैसे काउंसलिंग करते हो उसकी समरी.
So first workflow.
Sir, your voice is breaking. You put your question in chat box. Sir, your voice is breaking.
सर मैं पूछ रहा था सर एक वर्कफ्लो के लिए एक टास्क के लिए एक वर्कफ्लो बनेगा एक फोल्डर बनेगा सर.
Yeah. That definitely. I have made, I'll show you my screen. See how many custom GPTs I am using. For every task I have, for operative notes different, IPD notes different, for TPA queries. What happened in my TPA queries? Previously, I used to have daily 20 to 30 minutes answering those stupid TPA queries because my notes quality was very poor. Because my notes quality was, I'll show you. This was my notes quality 1 year back. I'll just show you. This was my quality. So whenever I submit these kind of records, so every time my TPA had a query ki why it was stayed for 10 days, why it was for 20 days. I am doing right things, but still I am getting queries. Now this is my notes which we are uploading. So first of all they are clear कि मैं क्या बोल रहा हूँ, क्या करना चाहता हूँ, पेशेंट को क्या दिक्कत है. If he has to decide based upon this versus this, so queries वैसे कम हो गई. Then I made a custom GPT where before putting anything on the Ayushman portal, they just screen through this Ayushman query answer portal where I have given it a query that what are the guidelines, और अगर कुछ issue आता है तो review this discharge summary. So my TPA guy, what they do, they just upload the discharge summary here and just press this review this discharge summary. When they do it, it will tell in advance कि ये सवाल आपके पास आने वाला है, डॉक्टर हर्ष से जाके इसको ठीक करवा लो. So this is the way I handle the queries. I hope it's clear.
Yes, sir.
So for every workflow, for every small workflow, I have made different kind of GPTs to make my life easy. So for the surgery, 10 बजे. Then pediatric OPD counselor I have. Then old record summary. Then pediatric discharge. For pediatric I have a different because उसका knowledge base different है. For neonate I have different. For dental report assistant, I have made for everything, even for Hagen writing scripts. I have a Hagen script writer, means my marketing guy. I have given my knowledge to him. He daily writes scripts based upon himself only. अपने आप वो script लिख लेता है, मेरा अवतार बना के वीडियो डाल देता है. That's it. मुझे कुछ करना नहीं है.
Harsh, you take little bit water, comes Haran say. To the learners, sorry to interrupt. We have a separate session for how to build your own custom GPT from ChatGPT, OpenAI, and gems from the Google Gemini. We have a session. If you go through the AI curriculum, just you know how Dr. Harsh is using his own custom GPT to generate various documentation. Okay. Harsh, you can have a little bit of water because
Oh, no,
maybe...
it's okay, sir. No issues, no issues. Thank you.
Okay.
So one query was how to take consent. Yes, it was a query, na? कि consent
Yes.
कैसे लेना है?
Yes, sir.
So what I do, I have a simple app in my phone, and whenever I am talking to the patient, I just keep that phone switch on. Switch on means वो मेरी सारी बातें सुन रहा है. Rather, now I have this AI device which is called a humanizer. Neo Sapien, sorry. This Neo Sapien continuously listen whatever I am talking about, and it give me a summary कि आगे दिन में मुझे क्या करना है. But whenever I am doing counseling, this phone is sitting on my table and it continuously listen to it and see how it creates a consent form.
बच्चा 28 हफ्ते का हमारे पास आया था जी. इसको पहले 2 दिन कोई ब्लीड नहीं था. आज सुबह जो रूटीन अल्ट्रासाउंड किया है उसके अंदर इसमें ब्लीडिंग आई है. अब इस ब्लीडिंग की वजह से हो सकता है बच्चे के दिमाग पे असर रहे. हम 100% तो अभी नहीं कह सकते. अगले 1 से 2 दिन में देखना पड़ेगा ये ब्लीडिंग बढ़ रही है या कम हो रही है. जो भी होगा आपसे शेयर कर देंगे आप.
So when the child came to me on day 3, I have counseled him that I have done ultrasound and there was a bleeding on it. Okay, there was a grade 1 bleeding. When you counsel this to your patient, and after 3 days, after 1 week, if child develop hydrocephalus and you tell आपको बताया तो था, so what is the general response? Can anyone tell? Generally patient आके क्या बोलता है?
नहीं सर, ऐसा तो कुछ हुआ नहीं, आपने हमको बताया नहीं था।
बिल्कुल,
आपको समझ में नहीं आया जो बोला था आपने।
बिल्कुल, सबके साथ ये होता है। तो अभी मैंने क्या किया, मैंने जो जो बोला उसको रिकॉर्ड किया, ये कस्टम जेम्स पे डाला, एंड आई हैव अपलोडेड, एंड जस्ट अ सिंगल क्लिक, दैट्स इट, आई एम नॉट डूइंग एनीथिंग एल्स. सो आई हैव अपलोडेड दिस फाइल विच आई हैव रिकॉर्डेड few seconds back. This is mp3 file जो मैंने अभी बात किया, and it will create a beautiful summary in a way, in a language. This is Hindi language, क्योंकि हमारे यहाँ पे हिंदी समझ में आता है.
हमारे पास आया था जी.
It is created in few seconds only. जो मैंने बात किया है सिर्फ वो बात लेके जाएगा. 28 हफ्ते का बच्चा था, रक्त स्राव हुआ है, अभी हमें 1-2 दिन महत्वपूर्ण है. जो जो चीजें मैंने बोली है ये सबको हिंदी में 1 सेकंड में टाइप करके दे रहा है. एंड व्हाट वी डू, वी जस्ट टेक अ प्रिंट आउट ऑफ इट, गिव इट टू द पेशेंट, एंड वी टेल देम रिटर्न मी आफ्टर 1 hour. Just read it. You cannot give any printed performa to them as the surgeons do, because our counseling is entirely different from one child to second child. Agree? So this is the way I have given. I will copy this, put up into some Microsoft Word. If you need any editing, you can do editing also. The language, Udiya, Telugu, Punjabi, Hindi, whatever you wish to have, it will create within few seconds. And this you can give to the patient. Patient will read it and return after 1 hour. No hurry. आप उसको बोलोगे अपने साथ वालों का साइन कराकर दे के जाना, एंड पुट अप इट इन दो फाइल. देन पेशेंट रिफ्यूज नहीं कर सकता कि बताया नहीं था, एंड यू आर मेडिको लीगली सेफ ऑल्सो. आई होप इट इज यूजफुल.
Yes, sir.
So this is regarding the consent. That was regarding discharge summaries. Then the OPD thing. Now tell me what you wish to have, and I'll create in front of you right now.
सर NABH में होता है कि पेशेंट कम्युनिकेशन लो.
Yes sir.
उसका साइन लो.
साइन लो, बट साइन करने के बाद भी मुकर जाता है ना सर. साइन लेके तो कोर्ट में आप बच जाओगे, बट द ट्रोमा कहां पे होता है, कब बताया था. एक्चुअली पेशेंट डोंट अंडरस्टैंड इन 5 minutes, बिकॉज एट दैट टाइम उनका जो ब्रेन का सीरोटोनिन या जो भी हॉर्मोन्स है हाई होता है, उनको कुछ समझ नहीं आ रहा होता. यू टेल देम फॉर 10 minutes, एंड में अच्छा बच्चा ठीक तो है ना, ये सवाल होता है. आई होप इट हैपेंस विद एवरीवन.
आखिर में यही बोलते हैं,
बच्चा तो ठीक है ना, अच्छा
ठीक है ना, अभी कुछ गड़बड़ तो नहीं है.
यू आर टेकिंग
MOD सब तो ठीक है ना.
हाँ, तो ये होता है. सो द बेस्ट वे इज कि जो मैंने तुमको बोला है, 1 घंटा बाहर बैठ के अपने हॉर्मोन्स नीचे करके अपना एमिगडाला शांत करके पढ़ के आओ, सो दैट दे कैन अंडरस्टैंड इन द लैंग्वेज. क्योंकि रूटीन में हम कंसेंट किस पे साइन करते हैं, इंग्लिश. हाउ डू यू मेक ए कंसेंट इन उड़िया, हाउ डू यू मेक कंसेंट फॉर एवरीथिंग. कभी इंग्लिश वाला पेशेंट आएगा, कभी हिंदी आएगा, इसमें सिर्फ आपको टाइप करना है हिंदी, दैट्स इट. तो हिंदी में आ गया. उस पेपर को आपको पेरेंट्स को देना है. पेरेंट्स 1 घंटे बाद रिटर्न करके जाएगा. बाय द टाइम ही हैज अंडरस्टूड कि क्या क्या चीजें डॉक्टर कहना चाहता है, ही कैन कम बैक एंड आस्क ऑल्सो. नाउ आस्क मी एनीथिंग व्हाट यू वांट टू क्रिएट, एंड आई विल क्रिएट इन फ्रंट ऑफ यू राइट नाउ.
See, we want to give patient education brochure to patient.
Okay. Now I'll show you patient education brochure
in OPD.
Okay, sir. I'll show you. What kind of you want to give a
in picture and cartoon and everything.
ये पिक्चर भी बन जाएगा सर, जो बोलोगे वो हो जाएगा. Tell me what disease you want to explain to your pediatric patient. Any
A
name?
child of 8 years. I'll narrate the things. Child of 8 years
Huh?
is
What is
obese.
it?
His weight is 46 kg.
Obesity.
His weight is 46 kg.
Okay. And what do you want to explain?
Diet chart and the what are the precautions should take by the parents in Hindi with help of some cartoons and some uh, pictures.
So I have written just 7 words. 8 year. I have intentionally given a wrong spelling of obesity. I have intentionally written weight 46. I have intentionally written गंदा सा कुछ डाइट चार्ट एंड लाइफस्टाइल हिंदी. कुछ भी आपको समझ में नहीं आया होगा, मुझे तो नहीं आया, but I have written it intentionally. See what it is creating. It will take just 1 minute. Just keep an eye on it. By the time anybody else can ask, क्योंकि इसमें थोड़ा टाइम लगता है 1 मिनट.
Sir, it's looking so smoothly. You are doing this utilization of ChatGPT,
Yeah.
but it's pretty difficult for me to go through all the steps right now. What I'm feeling, because
Sir,
I have to see the patient in OPD. I have to admit that patient. I have to send that patient in ICU and guide the nursing staff and duty doctor. He has to write the notes. Sister has to give the injections and upload the given injections in the worksheet. Everything has to be done, but it's pretty difficult right now. What I'm feeling.
so I have started from where identify your first biggest problem. You have a problem of ICU. The guy who has asked me from the obesity chart, he is the doing OPD practice. उसके लिए ये obesity के लिए देना. सर कैसा लगा पहले बताओ. Sir, somebody has requested for obesity chart.
Nice, very nice.
So this you can just print out and give it to it. So this is for the OPD flow. That's why I started from identify your problem first. It's not a कि Dr. Harsh जो करते हैं, that is the only way. This is the beauty of AI. You have to understand the basics of AI. Okay, I am just not saying कि मैं बहुत बड़ा हूँ. What do you think मैंने पहली बार AI कब यूज किया होगा? Any guesses?
3 साल पहले सर.
2 years back.
Last April 2025, just 1 year 2 months back. First time. And if I can do it, anyone can do it. You people have done MBBS, MD, 10-year practice. Your IQ is above average, and a below average person like me can do it very, very easily. So just give it only 30 to 40 hours of your life. That's it.
Dr. Harsh, you share this infographic in the group chat.
सर, ये इंफोग्राफिक का जो आपका कमांड था बहुत ही क्रूड था, तो ये इतना बन गया. आपका बैकग्राउंड में आपने पहले से फॉर्म दे रखा हुआ है या आपने
सब कुछ दिया हुआ है. Everything is pre-created. That is the मतलब importance of prompting.
क्योंकि क्या होगा सर, अभी आपने जो कमांड दिया था बहुत ही क्रूड कमांड था.
Yes, sir.
लेकिन probably you had a prompt which is already tailored and customized for this particular type of infographic, right?
Yeah.
Got it.
So that's what मतलब that is the thing I am asking you to learn in next 40 hours only. You have to invest 40 to 50 hours of your lifetime. फिर आपको इतना मजा आएगा कि आपको और कुछ करने का मन नहीं करेगा. मेरे साथ तो यही हो रहा है. डेली आई एम सीइंग ओपीडी, उसके बाद आधा घंटा 1 घंटा खेलता हूं मैं एआई के साथ. दैट्स इट. आई हैव नॉट डन एनी कोर्स. आई हैव नॉट रेड एनी एआई बुक्स. आई हैव नॉट डन एनी कोर्सेज ऑल्सो. जस्ट 1 डे वर्कशॉप लास्ट अप्रैल मई में किया था. उसके बाद से बस मुझे इतना मजा आ रहा है कि यही पढ़ रहा हूं. एंड यू कैन डू इट. So I have shared, sir. Deepak, I have shared. Now tell me anything else. Whatever you say, I'll create right now in front of you.
सॉरी सर, आपके हिसाब से आपने कौन कौन से बना रखे हैं?
सर मेरे को तो सब बना रखा है, आप कुछ भी बोलो, मैंने आप जो बोलोगे मैं वो भी बना दूंगा।
एग्जाम्पल सर, हम पेशेंट का फ्लो ले, तो पेशेंट का
There is
फ्लो लिया।
Dr. Harsh, there is a question from Dr. Nisha Agalve.
या
Treatment orders through AI tools.
treatment orders never should come through AI tools. There are some green light, there are some yellow things, there are some red things. Never share treatment orders with the help of AI. Yes, you can generate something and then you have to edit before giving it to the parents. Okay, use databases. In emergencies, you can use, but apply your mind before giving treatment orders. The safe things is notes. The safe thing is counseling. The safe thing is basically you are using it as your assistant. आप अपने असिस्टेंट से क्या क्या करा सकते हो? आप एक सर्जन हो, क्या आपका असिस्टेंट सारी सर्जरी करेगा या सिर्फ क्लोजर करेगा? जस्ट क्लोजर ओनली। आपके असिस्टेंट से क्या क्या करा सकते हो? उससे काउंसलिंग समझा सकते हो, दवा ऐसे लेना है।
Dr. Nisha, we have a separate session on CDSS. CDSS का मतलब क्या है? Clinical Decision Supporting System. In that I will cover you. And as wisely said Dr. Harsh, see, AI mainly using to decrease your burnout due to documentation. That is very, very important. It is good in creating the very good diet charts and post follow-up visit. All those things you can use it without any scratching or anything. Hallucination rates will be very, very less. Only thing you have to try it with custom GPT or custom jumps. And regarding CDSS, we have a separate complete 2-hour session. I think there I will cover. Don't worry. Yes, Dr. Harsh.
This is one tool. Custom GPT is not the entire tool. I am showing you this Sapiens. This is Neo Sapien. It is just listening to it, everything what I am talking. उसको सुनता है, उसका ट्रांसक्राइब करता है, मेरे फोन में सब कुछ है, उससे नॉलेज बेस बनता है, उस नॉलेज बेस के बेस पे फिर मैं अपना एआई ट्रेन करता हूँ. There are Google Forms for data collection. You tell me any workflow, I'll give you an example in front of you.
Dr. Harsh, Dr. Nisha is telling she want to give by using scribings the treatment, and it has to upload to the chat GPT, the treatment aspect. That means she is giving you order.
Dr. Nisha, can you switch on your camera and discuss, if you don't mind? No issues. Treatment orders, speaking and then uploading, yes, you can decide it, but for upload treatment decision, I would prefer a EMR where drop downs are there, because drug prescription dosage is a very sensitive matter. Yes, you can use AI, but you have to review the orders, you have to review every time when you are giving parents the treatment based upon AI only.
Right
Sir,
now,
just
Dr. Nisha.
Yeah, Dr. Nisha is asking. Let her speak.
Yeah. Please.
Yeah, I just want to ask that at the end of the every notes, we advise the changes and all other things. So we can add it directly as shown in the first slides, na?
We can add directly
So
means?
at the daily notes, at the end of the daily notes, whatever we speak in the phone, and then we upload in the system. So if we tell the treatment also, then it can be added in the at the end
It
of
can be
the
added, but what is my
notes.
workflow? What is my workflow? As I told you, whenever I am doing the round, phone is with me and I am just speaking into it. The notes which it has created, my MO will review before putting into EMR system. So there must be
Okay.
human in the loop. You cannot rely entirely on AI right now, at least. Maybe after 2 years we are doing. There must be human in the loop. So my MO is in the loop. My time is being saved and it is being standardized कि मेरे नोट्स इसी फॉर्मेट में होंगे. डिस्चार्ज समरी बनाने में क्या होता है, रूटीन में आप 8 बजे राउंड लेते हो, 9 बजे राउंड लेते हो, and you come into the OPD at 11 o'clock, and when the bed is empty, anybody can tell कितने बजे बेड खाली होता है. आपने सुबह 9 बजे ऑर्डर किया था. Anybody? Anyone?
4 p.m.
जनरली
2 o'clock.
2-3 बजे खाली होता है, बिकॉज आपका एमओ पहले उसको बिजी होता है, सैंपलिंग करना होता है, फिर वो लिखता है, फिर वो बाहर खड़ा रहता है आपसे चेक कराने के लिए। तो मेरी डिस्चार्ज समरी कैसे होती है, मेरे नोट्स रेडी हैं, मैं सुबह 9 बजे राउंड पे गया, इसको छुट्टी कर दो, उसको क्या करना है, नोट्स को कॉपी पेस्ट करना है, डिस्चार्ज समरी प्रॉम्प्ट डालना है, स्ट्रक्चर्ड नोट्स जैसे मैं चाहता हूं वैसे बन के आ जाते हैं। ओके, एंड गिव इट टू द पेशेंट, बेड इज एम्प्टी, जाते हुए पेशेंट मेरे से मिलके जाता है। ओके, इफ सम चेंजेस आर रिक्वायर्ड, जाते हुए मैं कुछ करके भेजूंगा। सो ह्यूमन इन द लूप इज ऑलवेज देयर, एंड माई बेड इज एम्प्टी एट 10:30 AM इन द मॉर्निंग। जो मैं 11 बजे एडमिट कर रहा हूं उसके लिए मेरा बेड खाली है। नहीं तो पहले क्या होता था, 2 बजे सर अभी कर रहे हैं, आपको दिखाने आए थे। ऑल दीज थिंग्स यूज टू हैपन, एंड विद दिस स्टैंडर्डाइजेशन थिंग आई एम एबल टू manage my bed in time.
There is one more question from Dr. Ria. I have a PMJ unit. That's a probably central government. These notes are valid there. How can I upload it?
All of these notes are valid. I am using it for last 1.5 year. पहले मैं क्या करता था, इनका प्रिंट आउट लेके स्टैंप लगाता था। ओके, नाउ आई हैव मेड अ डिजिटल स्टैंप ऑफ माई सेल्फ। ओके, एंड व्हाट माई असिस्टेंट विल डू, notes made, my digital stamp goes, and that is uploaded.
So I request all the learners, start slowly. Whatever the software you are using in your clinic or hospital, and we will have a separate vendor demo session. Probably in the next week I will arrange. We have a lot of 2-3 people having a cloud software. You can use a tab. You can take it through the rounds. That we have a 2-3 vendors are there. You can try with them. So integration of your different mode of AI tools into one documentation in one digital device is a very, very important. And Dr. As Harsh said, human in the element is very, very important before you giving a sending the report to the patient. I think that is given. I think no more question in the this thing.
Okay, thank
So
you very
Prashant
much.
Kari is there. Yeah, I
Thank
think
you
you
very
need
much.
rest, Dr. Prashant, Dr. Harsh. I think even I had suffered Coxsackie Bonham disease last week. I had to take IV medications and all. Throat is like a burning and lot of sore throat. It was. I don't know there in Haryana. Here a lot of adeno Coxsackie is going on. HFMD.
Sir, Dr. Prashant, I have sensitized them, and you have to take them through a nice path. कैसे बनाना है, क्या करना है. I hope everybody is happy with me. कुछ गड़बड़
Harsh,
नहीं
I
किया
was
आपका
in second session, but I'm sure that you must have mesmerized everybody with your all custom GPTs which you have made, and everybody will be eager to learn how to make it. So I think as we talked in morning, I was in second session, so not able to attend your today's session. But as we talked in morning, Harsh, I'm supposed to teach them the prompts and the custom GPTs, how to make it, right?
Yeah.
Fine. So thank you so much. And thank you so much, Dr. Deepak, for inviting. It is always a pleasure to be with you. And at this time, I usually like a response from everybody. So can we just ask a people, what do you know about a prompt? What is prompt? Can you just, anybody can say what is prompt?
It's a command that is given to an AI system to
Perfect.
get our desired result.
Yeah. Command that is given to a AI system to get a desired result. Very good, sir. Anyone else? A question to AI, the instruction to AI. Yeah, you can write in chat box also, and you can just speak also. That will be better because that will be helping us to learn better way. So it's been said that whenever you give a prompt, the thing is, if your prompt is good, then the output will be good. The things which you ask will be said perfectly by AI. If I ask AI, what is fever? Or if I ask AI, what is jaundice? Then the answer may differ. When I say what is jaundice, the AI can give me answer. All LLMs or any ChatGPT, Gemini, anything. They can give me answer that jaundice is increase in bilirubin. They can talk more about a cholestatic jaundice. They can talk about a indirect hyperbil or anything. But if I give a typical command that I want to know about a neonatal jaundice and I want to explain this in a simple language to a parents, then the output will be different. If I say that I want to explain this to MBBS students, again the output will be different. If I say that my tone should be academic, then the answer will be different. And if I say that my tone should be a Avenger tone, then the answer will be different. So talking about this, most important things which came to our mind, and we will be seeing everything by the practical examples. I hope my screen is visible. Hello?
Yes, yes, Prashant. You are
Yeah,
visible
fine.
and audible.
Yeah,
Yeah.
fine. So we'll just go with the blank sheet that what I said is what is jaundice. And I've just opened a chat GPT and let's see the answer. And if you see the first answer given is a definition, the common causes, the symptoms, the treatment, and when to seek medical care. Now, this may be useful, but as I said, I'm more interested into the neonatal jaundice. So I'm here using a dictate tool, which is there in a chat GPT and which will be useful to you people. And I'll say it differently. I want you to explain neonatal jaundice to a parents in a frequently asked question formats in a simple language, no jargons, no hallucinations, and keep this under 1,000 words. Now, when I say this my dictation has been typed by ChatGPT, and when I give this prompt at that time, if you see, this is an answer given by a ChatGPT that neonatal jaundice, the frequently asked questions by parents: what is newborn jaundice? Why does my baby have jaundice? Is jaundice dangerous? When does jaundice usually appear? How do I know if my baby has jaundice? Can breastfeeding cause jaundice? How often should I feed my baby? Does sunlight cure jaundice? What is phototherapy? Will phototherapy hurt my baby? Can jaundice come back after treatment? When should I call the doctor immediately? Can jaundice be prevented? What is the most important thing for parents to remember? The myths and facts and the golden messages. See, with a simple prompt of a this is less than 50 words, AI has given me a satisfactory answer. Do you agree or not? I just want in chat box some answers,
Yes.
whether you agree with
Yes.
this or not.
Yes.
Yes. Now, the beauty is, if I give the prompt in a better way, still the answer will be beautiful. And let's see what else can be done with this. So I'm just copy pasting the first command which I have given. And can you identify when I've given a command, what are the things I've said to AI? There is certain things called as a purpose. My purpose was to explain to parents. I forgot to tell AI to act as a pediatrician. But then because I said neonatal jaundice, it already took the role of neonatal jaundice. I've defined the audience that it is my parents. I said the specific things and the output was also specific. There were no jargons, limitations were given, no hallucinations. But if I just add this, as I've designed my own framework, which I'm going to show you, that please improve this prompt by Prashant way. Okay. See, I've just added a simple word and you see what this AI is saying. This AI is saying, my purpose is to create a parent-friendly educational chapter explaining neonatal jaundice in a frequently asked question format. The content should help first-time parent understand the condition without creating unnecessary fear. The role, which I missed to say, but he is saying us that you are an experienced pediatrician, neonatologist, or a medical educator and best-selling parenting author who excels at explaining complex medical topics in a warm, reassuring, and easy to understand manner. Audience, we have said, but then AI is suggesting that is for the first time parents, Indian families, grandparents, readers with no medical background, and the specific details which you want that cover the following topics naturally: that what is newborn jaundice, why does it happen, is it common, is it dangerous, when does it usually appear, how can parents recognize it, how is jaundice diagnosed, why are blood tests sometimes needed, when is treatment required, what is phototherapy? Is phototherapy safe? Can breastfeeding continue? Does sunlight cure jaundice? When should parents contact their pediatrician? Can jaundice be prevented? What is the long-term outlook? And include common myths and facts, practical advices, warning signs that require urgent medical attention. And how do you want to format? Then it should be a title, a brief, reassuring introduction, then question, parents' question, a doctor's answer. Each answer should begin directly answering the question, explain the concept, use short paragraph, use bullet points, end with one practical takeaway, and finish with myth versus fact, key take home message, and one memorable golden message for parents. And accuracy, which I forgot to tell, usually we say according to the NNF guideline, according to the CGP guidelines, according to the WHO guidelines, according to the UNICEF guidelines, all IAP guidelines, any references, or according to the PubMed published papers, according to the Cochrane papers, all this accuracy and references has also been said. And nuances, we have said the maximum length, that is 1,000 words, no jargons, no fear-based language, no exaggerated tasks, and do not include unnecessary physiology and everything. And the tone should be warm, empathetic, conversational. So your 50 words prompt is been improved by AI. The reason is simple, that this AI knows what is Prashant's way or what is Prashant framework. And if I say the final, please give me final output, then it is going to give us the final output in a way. You have already seen the first, but now it is uniform with take-home tip in everything, the questions which AI has suggested you, and most important thing, every time you should be there in a human in the loop, which has been said that for all these things, you should be there. So I think this was rightly been told by Harsh that if you use proper prompts, then you will have better results. I'm sure Harsh must have shown you how to make discharge summaries, how to make OPD notes, or how he has made the custom GPTs. So I want one volunteer from the group. Can we have one volunteer? Hello?
Hello?
Yeah. Yeah, Dr. Pradeep. So Dr. Pradeep, we will go step by step and we will create one custom GPT for you. Is it fine?
Okay.
Okay. So before that, I think I'll just show you the Prashant framework, which I have just shown this. So in this, we will just write step 1. Okay. When you write step 1, it asks you what is your purpose. So at present, as we already said that we want to make a custom GPT, right? That is our purpose. So that is not there in this. So we want to make a custom GPT. Or for what? For what you want a custom GPT?
Giving prompts.
Okay, custom GPT for giving prompts. Okay, so we want to make a custom GPT for giving better prompts. Is this right?
Yeah.
Okay, so this is your purpose in short. Okay, so I'm just entering it and you see the AI is asking your step 1 is completed. create a custom GPT that helps users with write better, clearer, and more effective prompts. Okay, this is your purpose. Now, what role the AI should have? See, the AI says, should I act as an expert prompt engineer, AI productivity coach, chat GPT prompt optimization specialist, senior AI consultant, prompt engineering trainer, educational AI mentor, AI workflow architect? What do you want?
AI productivity coach.
AI productivity coach. So I'm just writing 2 over here, okay? Because that was the second option, okay? Act as an AI productivity coach. Who is the custom GPT designed for? For whom you want to design? For the beginners, students, doctors, teachers, business professionals, content creators, or everyone?
For doctors and health professionals.
So doctors and health professionals, okay. Then your specific details. When you're making a custom GPT for the doctors, the examples like medical specialty, pediatric, ICU, radiology, clinical scenario or case details, intended output will be SOP, summary, presentation. What do you want? Target audience and everything.
Medical specialty.
Medical specialty. Okay. I will select over here the target audience also. That will be beneficial because I'm giving more details and then guidelines to follow IAP, WHO, CDC, NICE, whatever I said, I'll select that also. And do you want to have some word limits for giving a prompt or you
Okay.
want a longer prompt?
Limit the prompt.
Okay, so
Seven
limit
words.
the prompt to less than 1,000 words.
Okay.
Okay, fine. Okay. Specific details you have said. Then how do you want format your prompt? Directly ready to copy prompt, prompt with sections, role, task, context, format, and constraints. See, this is most important. I mean, when I said Prashant, this is my custom, but then in AI word, it is role you are giving, a task you are giving, context you are giving, format you are giving, and constraint you are giving. So that is most important thing. You want it in markdown format, JSON or XML format, bullet point. What do you want, sir?
Bullet form.
Bullet forms. So that is 5 number. Okay. Okay. Accuracy and references. Which standards or best practices should the custom GPT follow? OpenAI prompt engineering best practices, evidence-based medical guidelines, latest.
Guideline.
Which one, sir?
Second.
Second. Okay.
And avoid hallucinations.
Okay. So that we will add now. Nuances and constraint. What should the custom GPT avoid or always include when creating? So avoid vague instructions,
Okay.
avoid unnecessary jargons, right? That is 3 is also fine. Final format under 1,000 words. Then you said avoid hallucinations. Okay, fine. That has been said to AI. And last is tone. What should be the tone?
Teacher-like education.
Teacher-like. So 4. Okay. So after giving this 8 things, all 8 steps completed, your custom GPT instruction prompt for a medical prompt engineering like.
So we have to find
You are
this
an
custom.
expert medical to help professionals. No, that is what first we are just making a prompt. We are not making a custom GPT. At present, we are just making our prompt better. After this, we will make a custom GPT. Custom GPT is like you give a work to your intern that, okay, prepare a discharge card. Okay, so that your houseman doctor or the on-duty doctor will be doing that work only. If you say prepare a vaccination reminders, then that is a separate task. Nowadays, we do have a AI agents. I'm sure Deepak will be having that in later time. But at present, one task, one custom GPT. At present, you said me that I want to make a prompt to create a custom GPT. So this is a prompt. Now this prompt says this custom GPT will be having this purpose, the role, audience, everything. The same thing which you have seen at present which Prashant form is giving. So what you should do is you just copy this prompt. Okay, we just copy this prompt. Okay, done. Then those who are using a GPT Go or a plus version, if you see at the bottom, it is GPT Go version which is there, and GPT plus version is there, can directly go to GPTs and create the custom GPTs. Or if you're using a free version of ChatGPT, Gemini, anything or Claude, then what I will do is remember this as a master prompt for my future work. And you can just give a name. Please remember is a Pradeep way of giving a prompts. Okay. At present, because I do have a Go version, I'm showing you how to make the custom GPT also on this only. Then we will have a different custom GPTs of preparing discharge cards, OPDs and everything. But at present, whatever you said, so if you see, when I opened a GPTs, on the right side, top corner, there is an option called as a create. Can you see? Hello? Yeah.
No,
On
not
right
visible.
side top corner. See, can you see the cursor on my screen?
Yes, yes.
Cursor is going to the right top arrow and create button is there. Can you see it now?
Yes, yes.
It is
So when
there.
yeah. So when I click it on create, it is asking me to create a custom GPT, a new GPT. Now, because we have already made the custom GPT prompt, I'm saying Pradeep custom GPT. Okay. And description at present I'm not giving, but the instructions which we have prepared are being copy pasted over here. Okay. The custom GPT instructions for a medical prompt engineering. Okay. Is it fine?
Okay.
If I do have some materials which is there, I can add as a knowledge files. Deepak, if I'm not wrong, custom GPT is allowing around 20 files to be uploaded of around 500 MB, right?
Yes, yes.
Yeah. So over here, if according to your work, if you have some PDFs, you can upload the files and this will be remembered by GPT as a resource material. And the model, if you just click on this web search and image generation, then that will be there. If you don't click, then this web search will be not there. And now I'm creating on a right side again with a simple prompt, which you have said, not doing anything. When you create it, three things will come, whether it is for you only, anyone with the link, or for the GPT store. So at present, anyone with the link, we are just saving it. And this custom GPT, Pradeep GPT, is ready. Now, I'll just post this custom GPT's link in a chat so that, sorry, this custom GPT, it is not custom GPT's link, it is just a minute. Yeah, this is link of custom GPT, view copy GPT, and then I'm just posting this into our chat so the people can also practice this Pradeep custom GPT. Now let's start Pradeep custom GPT and then let's make a OPD consultation note. Okay. So the step one, the purpose.
The previous one, we made the prompt in the step one. We went to our new GPT.
हाँ.
वहाँ से आके फिर से can you repeat? Configure किया.
Okay. हाँ.
Configure किया. Configure किया. Can you go back please? The अपना ये मोड में जाके आप किया ना?
मैं फिर से दिखा देता हूँ आपको.
Because we are doing it our laptop also.
Okay.
But
Fine.
not the way you have shown.
Fine. If you're doing it in your laptop, so then अभी जो मैंने chat GPT में डाला था ना, जैसे what I have done is first I have designed a prompt engineering Dr. Prashant way. If you see the title of that custom GPTs, okay, in which fix that you will be asked 8 steps to create anything. May it be your custom GPT, may it be your discharge summary, may it be your image generation, anything. But this is a custom thing which I have made, and I've made it for the Dr. Pradeep also. So what I've done is, first step, inserted the custom GPT role. Second, role. Third, audience. Fourth, specific details. Fifth, how to format. Sixth, I mean, whatever sir has said, I've just taken it, accuracy and references. Seventh, nuances and constraints. And eighth was a tone. After giving this to Prashant Prompt Engineering, Prashant Prompt Engineering has given us one optimized prompt, which is this custom GPT instruction prompt. So I just copied it. Clear till now?
Yeah, Prashant, one minute.
Yeah.
I did the same thing. Just I'm mentioning, I want to make a prompt, custom GPT for better prompt. I have written. बट ये जो है ना, जो आपने जो जितने जो ये
मैं वही बोल रहा हूँ सर, सही एक मिनट मैं जो बोल रहा हूँ ना आपको, एक ही मिनट सर, ये जो है ना, फिर से आपकी जो आप करेंगे वो नहीं होगा, वो मैंने बना के कस्टम जीपीटी रखा हुआ था जिसके अंदर से मैंने फिर से बनाया, अभी मैंने वापस चैट बॉक्स में डाला है प्रशांत इंजीनियरिंग प्रॉम्प्ट। तो इसके अंदर आपको ये स्टेप्स करने पड़ेंगे डायरेक्टली प्रशांत फ्रेमवर्क। सी योर एआई नोज Minash Sheikh, your AI doesn't know who Prashant framework is there. I said to my AI to remember this as a Prashant framework. From this, I have created a prompt which we have actually copied custom GPT instruction prompt, and then we went to custom GPT. Again, showing you in GPT, we have gone to custom GPT, created it, configured it, and now this Pradeep custom GPT is ready. And in this, now we are doing the second task. Is it clear? ठीक है। So अभी जो हमारा दूसरा काम है, जैसे I want some other volunteer also कि जो इसमें मुझे हेल्प करे कि क्या क्या कर सकते हैं हम।
सर इसमें हम लोग रैश से डाल के भी तो कर सकते थे प्रॉम्प्ट।
क्या कर सकते थे?
रैश से जो फॉर्मूला
हाँ,
होता
रैश
है
भी कर सकते थे। That is what I said. Role, task, purpose, context, फॉर्मेट, ये सब कुछ अपना होता है। मैंने अपना कस्टम जीपीटी बनाया था, वो मैंने आपको दिखाया। सेम मैंने प्रदीप सर का कस्टम जीपीटी बना के दिखाया है अभी आपको। आप कुछ भी सी द गुड थिंग अबाउट अ चैट जीपीटी इज आई जस्ट ओपन अ न्यू चैट जीपीटी एंड यू सी I want to make a discharge summary for a pediatric patient. Can you help me to make a mega prompt, a master prompt by a loop engineering method? सिर्फ इतना मैंने बोला अभी, ठीक है। और इसको जब मैंने एंटर कर दिया, बिकॉज एआई इज एडवांसिंग सच अ हाई दैट द मास्टर प्रॉम्प्ट ऑफ लूप अंडरस्टैंडिंग is immediately been said, I mean verified by AI, and AI has given us this big prompt to make a discharge summary. So there is no need of RCTF, Prashant, Pradeep, anything. You can just give a simple work also, but any prompt which you are giving must be humanized by you, because the way in which you are making a discharge summary will be a different, the way in which I may be making a OPD notes will be different. So you have to give your instructions. Say for example, from this Pradeep, which I was going to show you this, and I just said it by just less than 50 words, and AI has given me. So what I'll do is I'll just copy this. I hope my full screen is visible. Can you see the notes also? Or it is not visible? Hello?
We are seeing only master prompt.
Okay, you are just seeing the master prompt. I'll just share again. Yeah. Okay. I think now the full screen is visible.
Yes, yes.
Yeah. So the prompt which we got from the ChatGPT to make a discharge summary is over here. Over here, it is asking us that if you want to make a discharge summary, then you must have a diagnosis, age, sex, weight, admission date, discharge date, chief complaints, relevant history, examination findings, important investigation, final diagnosis, hospital course, treatment given, procedure performed, response to treatment, condition at discharge, medication, follow-up advice, and red flag symptoms. Then, once I tell you this, cross verify for the consistency. That is age consistent everywhere? Does diagnosis match treatment? Are medicines appropriate for diagnosis? Are dates logical? Is discharge conditions compatible with treatment? Then improve this, rewrite the hospital course, then the safety checks, then generate the discharge summary using the following format. Now, this is the format in which the discharge summary will be there. So it will have hospital name, discharge summary, patient name, UHID. For a security purposes, we don't add all these things in a custom GPT. We will add manually later because identity is a big thing. The DPDP Act will be actually a big thing so that we don't disclose the identities. Randomly, we can say a 7-day-old female with a weight of 2 kg was admitted on this date and discharged on this date. Diagnosis, complaint, everything has been given. So in one prompt, this has been said everything to us, which we can use in making the our
Yes.
discharge summaries. Okay. Coming back, not to confuse more, our aim is to make first give better prompts, have better prompts, and then make the custom GPT. So again, we are just made one custom GPT of Pradeep, and from this, I'm showing you how to make a custom GPT for making a discharge. So my purpose over here is create a discharge summary for admitted in ICU patient. Is that okay? I need someone to answer.
Very short.
Yes, yes.
Yeah, this is a first step only. This is my purpose. So we are just building a custom prompt only. So we are going step by step. The way in which Pradeep sir has given me the instructions to build a custom GPT prompt. Now we are giving a prompt to build a discharge summary. So in that, what should be the role? So it should be a senior neurologist and NICU consultant. That is the role which I feel is good for making a discharge summary. My audience will be over here because again the role is complete. Then the audience, this will be the audience will be a receiving medical records because this is official document. So I want it for the hospital records as a medical records. Specific details, I need it for the all NICU patient, preterm, surgical, sepsis, RDS, HI, everything. So I need it for everything. So I selected it. Then specific details or a guidelines. Again, this all are a guidelines, WHO, IAP, NNF, AAP, NICE is fine. And I'm selecting that. How to format. So structured template should be there with headings and placeholders, narrative paragraphs, bullet point formats, EMR ready template, SOAP format, everything. And additionally, I want that according to standard disease, please help and modify my summary of patients which fits to the diagnosis. So this is one more thing which I said. Then the format preferred output will be structured template with headings and placeholders, narrative paragraph, bullet point, EMR ready template or SOAP format. And then accuracy and references. See, whatever I said, they taken it. Accuracy and reference wise, should the AI strictly follow the latest evidence-based guideline and avoid generating any information that is not supported by the patient data? Please answer yes or no. So yes, strictly follow the latest evidence guidelines. And tone, it should be concise and EMR friendly, because nowadays we want to have everything by that way. So when we have said all 8 things, the optimized prompt for NICU discharge summary by this framework, though it is a Pradeep, but then Prashant, because it is purpose, role, audience, specific details, how to format important things, everything, condition at discharge, discharge medication, feeding advice, immunization, newborn screening, follow-up, and everything is there. And disease specific customization. So once this prompt is there with me, so I'm just doing simple thing that I'm just copying this prompt. And now from Pradeep prompt, I'm creating a Pradeep NICU discharge. In this, I'm just entering the thing, the prompt which has been given to us. It is creating. Once it is ready, then I'll be again sharing this link, anyone with the link, saving it. It is just taking a time. Just give me a minute. Unable to publish. Yeah, because this is a medical, so it will not publish anyone with the link. So what I'll do is create only me, and then this will allow, because this type of discharge summaries, you might have asked to Harsh also that please share your custom GPT with us, but he cannot share because this type of sensitive information cannot be shared with others. It can be with me only. So at present, I've just created it, and now I'm just sharing a simple case, and you see how beautifully the design will be there. I'm also not typing while taking around. If day by day, Harsh must have shown you day by day how to make the notes. If it is there, we just upload the PDFs from here, plus button, add photos and files. Or if at a stretch, in a one go only, I want to prepare an NICU discharge summary, please tell me one NICU condition and then I'll prepare a discharge summary. Anyone? Hello?
RDS.
RDS. Dr. Lalji has said RDS. So a preterm 28 to 30 weeker with birth weight of 1 kg was delivered by LSCS as mother was having preeclampsia. Urgent CS was done. The child was admitted on 10th of July. On admission, Silverman Anderson score was 7. Chest X-ray was suggestive of ground glass haziness. Surfactant was planned. Ensure surfactant was given. Child was kept on CPAP with FiO2 of 60%, PWP of 6. On first day, as the weight was only 1 kg, single surface phototherapy was started. Antibiotics according to our NICU protocol, injectable cefotaxime and amikacin were given after taking the blood culture. Parenteral nutrition with 1.5 gram per kg of protein was started in form of partial parenteral nutrition. Gradually, on second day of life, child passed urine 3 times, stool 7 times, sugar was normal, vitals were normal, distress was decreasing. So gradually, we have decreased the CPAP parameters to PWP of 5, FiO2 of 40%. ABG was done, which was normal. Septic workup was done, which was normal. Gradually, plan was to decrease the FiO2 to less 25% by a morning. Plan started with a trophic feed of 10 ml per kg of express breast milk through RT. On third day of life, child was better, so the CPAP was removed. Child was kept on high flow nasal cannula. Feeds were tolerated well, so improvement of 20 ml per kg of RT feeding was done, and simultaneously the IV fluid was decreased. As child was gradually improving, the feeds were increased. On fourth day of life, suddenly child had episodes of apnea. Injection caffeine was given. There was instability of temperature as well as tachycardia. Murmur was also there. 2D echo was done, which was suggestive of PDA. There was mild pulmonary hypertension. Injectable paracetamol was started. As there was features suggestive of shock, adrenaline was also been started. Child was kept in BM at this time. Gradually, as the parameters were again becoming stable, repeat echo was done after 3 days, which showed non-hemodynamically significant PDA now, and pulmonary hypertension component was decreasing. Feeds were restarted gradually as the child was tolerating feeds well. Feeds were increased daily 20 to 30 ml per kg. Once child was stable, kangaroo mother care was also been started. Mother was being taught how to give express breast milk through RT. As the feeds were tolerated, feeds were being increased regularly. AG was being monitored. On 10th day, child was off O2, on full feeds, and then it was been decided that child will be given a full feeds once child achieves a weight of minimum 1.6 to 1.8 kg, we will think of discharge. And simultaneously, the ROP screening was been done. So this is in nutshell a summary which has been said very vaguely by me. And when you have inserted this into our discharge summary, let's see what is the output. I'm not reading at present everything because I believe this has been perfectly been captured, but then again human in the loop is the advice that they should check it. And you see the hospital course which has been said very nicely. A preterm with 1 kg Silverman Anderson score RDS, single surface phototherapy, day 2, day 3, day 4, subsequent days, clinically stable kangaroo mother care. Important missing information before clinical discharge summary. So this is the things which is not given. So I'm just randomly giving the name. The baby's name is baby of Reshma, female child with UHID number 12345. Date of birth 10th July. Date of discharge 28th July. Antenatal steroids were given. Blood culture was negative. Antibiotics were stopped on 7th day. Peak bilirubin was 6. Duration of phototherapy 4 days. CPAP for 4 days. High flow nasal cannula for 2 days. Current weight at discharge is 1.8 kg. On discharge, hepatitis B, BCG, and OPV is given. BERA is planned. CHD repeat echo has been done, which we forgot to tell you, and it showed close PDA. Metabolic screening was not done. USG cranium was normal. ROP was normal. On discharge, child has been given iron, calcium, vitamin D, and caffeine, and follow-up schedule after 3 days, and the general discharge advice with all the danger signs are explained to parents. So the beauty of your custom GPT is if you just made this into a routine prompt, then this type of things they will not ask you. But because we have made all these things, so now you see your NICU discharge summary, the patient identification, the final diagnosis. I have not told but then extreme low birth weight, prematurity, RDS treated with surfactant, apnea, PDA medically managed, mild pulmonary hypertension, neonatal hyperbill, and suspected early onset sepsis, blood culture negative. Presenting complaint, significant maternal history, the hospital course, important investigations. Over here, if I would have given all other blood tests, then the result would have been better. And that's why we say we can upload the files of the reports. That will be fine. The procedures which have been performed, the medications given, the condition at discharge medication. I just said iron, calcium, vitamin D, and oral caffeine. If while making a custom GPT, I have given a prompt that I will be giving vitamin D 400 IU to all newborns once a day for a 1 year, a calcium supplementation to prevent the osteopenia for 3 to 6 months, the iron supplementation to all premature for 6 months to 1 year with the dose according to the body weight, then that would have been calculated directly. The feeding advice, the immunization, the newborn screening, which has been done, all these things and counseling and advice is being prepared. So this is how you can make your own custom GPT. So I hope this is clear to everybody that how to make the custom GPT. So this was one way of doing the things. Yeah. Okay. Can I know from the people that was this a easy job or not?
Yes, it was easy.
Okay.
Easy,
So-
but it will take some time to.
So see, this was very rough. If I want, I'll just show you some different things which we make, and I again will share the screen, the entire screen. You must have seen Harsh showing you many GPTs, me showing you live 2, 3 GPTs. This GPTs need your patience. You have to give sufficient time. Say, for example, this two I've just made at present, the Pradeep custom GPT and Pradeep NICU discharge, which has been seen. I've made many, but say, for example, when I said this Bhavnagar NICU, so this Bhavnagar NICU was given a sufficient information what should be there, and the books and everything was been fed. Same way, when I made a custom GPT for a vaccination, I'll just show you the vaccination GPT. Why it is not loading?
Type it in
Just,
the search, Dr. Prashant.
yeah, it is. But
What
in
name you have
custom-
given?
Yeah,
Go
but
to
the
the
thing is,
go to the custom GPT and search here.
no, the thing is, my GPTs are not having the custom option at present. I don't know why it is not there. It is not there. Just give me a minute. I just had that with me.
I will share otherwise my custom GPT.
Yeah.
On vaccination.
Yeah. So yeah, it is working now. Okay. Yeah, this is a vaccination. So see, this custom GPT of vaccination, which I'm just showing you, when I just made it, I'm just showing you that this vaccination, the instructions are being made from this is a different, just a minute. Yeah. See, this was a visual which I want to have. And for this, a vaccination was been there. I wanted to show you the IAP vaccination, which has been made. Just a minute. Deepak, I don't know why, but usually there is an option of searching the GPTs. It is not coming. Maybe in a MacBook, some issues is there, but otherwise it should usually come.
Vaccine IAP recommendation is there.
Yeah, IAP recommendation. Where was it? Yeah, yeah, vaccination IAP recommended. Okay, yeah, fine. See, the issue is this vaccination IAP recommended. When I just made it, it is not allowing me to make it public. It is making me for at present only for me. The reason being, when we are given this rules that there should not be any hallucinations, any names, dose, everything, and everything should come from the IAP Purple Book. The IAP Purple Book guidelines, it should be there. So say for example, let me ask a random question that which vaccine can be given to adolescent boy for prevention of HPV infection. Now there is a so much of debate going on about this, but the Purple Book has given the answer, and this custom GPT will search from this book only, because the prompt is given that do not give anything else apart from this book only. And you see the name is HPV vaccine name is HPV vaccine for adolescent boy. IAP Purple Book 2025 recommends HPV vaccination to all boys 9 to 14 years. Which diseases is prevented? Anal cancer, penile cancer, oropharyngeal, genital warts. Advantages of the vaccine, side effects, ideal age, schedule, and available vaccine. The Cervavac quadrivalent vaccine between 9 to 26. Nanovalent HPV vaccine approved by twin 9 to 15 years. So because in a prompt, I said that whenever somebody asks this, so at that time, give answer about the brand names which has been given, as well as give information which diseases have been prevented. So you can just ask a random question, vaccine question, and I will let's see whether this is working perfectly or not. Anyone?
Prashant, can I ask one question?
Yep, sure.
Yeah. Can we make the OSCE putting up the PDF over there? Number one.
Yes.
And how many PDF we can upload? Like, so is there a limit of 25 MB, something
So
like
that
that?
is what I said, 20 files or maximum 500 MB as far as I remember. But just to be very sure, what is the limit of uploading files to custom GPT?
Okay, so once we
Present MB.
once we upload over here, then again we have to make our own prompt for.
No, it is prompt is an instruction actually. See, we are already right. It is 20 files and 512 MB per file. Okay, maximum file size. Okay, and
so you can have 20 file of like 500. It's a big one. You can have.
Yeah,
many.
it's a theoretically 10.24 GB.
Very big. Yeah.
Huh?
What I mean to say, suppose I have to make a OSCE on acute care, 20 OSCE. So how can I make using the chat, my GPT?
Yeah, definitely.
How we can do that?
So simply, okay, so let's have your thing that I'm just randomly doing it, okay, at present. Yeah, we start with a blank only, new chat, okay? I'm a professor of pediatrics. I want to teach my students on a different topics, and for this, my way of teaching is OSCE. In this, please use Prashant framework. I'm saying Prashant framework because that will be there in my chat GPT. But for you, you have to use the prompt which I've given and give me a master prompt and use a standard references from IAP, WHO, PubMed, and Cochrane research papers. If you don't know, please say I don't know, and no hallucinations and no jargons. Give me a custom GPT prompt. So initially to a new chat, I said that give me a custom GPT prompt. So now it is giving me a master custom GPT prompt. See, in this master GPT, again, you will have to read it everything, but because we are online and at present I'm just showing you, so the OSCE clinical scenario will have the things in which style you want. You have to just change it over here. The task you have to change it. And all these Viva questions, you can just modify it according to your need. But at present, I'm just showing that we are just copy pasting what Chat GPT has given us. Okay, it has given us many things. Now, what I'm doing is, this is my final instruction. Again, I'm going to the GPTs, creating a custom GPT. Sorry, I forgot who was talking.
Minaj.
Minaz. Yeah. So Minaz Oski. Okay, this is my custom GPT name so that I remember it. Okay. Description, you can write it down, short description, that this OSCE is for the undergraduate students to teach them this. And the instructions are what is there, we have just copied. And if you have some books, then you can just upload it. If not, at present, just keep it blank and create it. Now, once I've created it, let's see if it is allowing for everybody, because we have to read all the prompts. If it is not violating any ethical things, then it will be for everybody. Otherwise, it will be only for you. But yeah, it is not violating any rules. So we are just copy pasting that and viewing that GPT. Okay. Now tell me the topic, Dr. Minaz.
Okay, so for example, acute care.
Acute?
Acute care in pediatrics.
Acute care in pediatrics.
Yeah.
Okay. Just a simple word, and let's see the magic. OSCE oriented the learning objective. What is acute pediatric care? Initial approach to a sick child. ABCD approach. Now this is, I think, not what you were asking for, right?
Yeah.
Yeah. So the mistake which was there in this, one additional, yeah, OSCE clinical scenario is there now. Okay. A case, a 3-year-old boy with this vitals, assess PAT, perform ABCD assessment, diagnose problem, septic shock, initiate emergency stabilization, plan investigation, and counsel parent. Is this fine?
Yeah.
Okay. Same examiner checklist.
Yeah.
Marks, hand hygiene, introduction, PAT assessment, ABCD assessment, important investigation, red flags. So by giving a single word only, your custom GPT is giving you all the things, including the Viva question, the self-assessment MCQs, which you have not asked for. Okay. And the reference is given IAP, WHO, AAP, and this APLS. Okay.
Okay. Got you. So
Got
this
it?
is one MCQ that we have prepared, right?
Yes.
And then we can copy from here and get a PPT from other tool also.
Yeah, definitely. I mean, you can just copy this and you can just start a new chat. Over here only, you can just say, give me the PPT outline of this OSCE
Yeah.
draft. Okay. Now, I've not said, see, if you give a better prompt, I want to deliver it for medical students. It should be of around 30 to 40 slides. It should have this. But still, it is a reasonably good. Section 1, introduction, learning objective. Section 2, all these things are there. I think it has given you slides around 28, 29. And I mean, so many slides are been given with sections. So what you can just do is just copy it. Go to any tool which you want to use. I usually like Gamma and
Claude XR actually.
so we just and design, and that will be ready. Your custom GPTs will be useful. At present, I'm not signed in, so it is not showing, but then yes, you can do it.
That's good.
So preferably, I mean, see, anything can be done, and to decrease your work, you should have at least this GPTs with their names. And as I say that this is first prompt engineering by PRASHNT, which is I use frequently. And then the others, which are like, which gives me instant things by my Hindi Q&A patient generator, FAQ generator. So I'll just enter one thing, because now the DGCI has given a clearance to dengue vaccine, I mean the Takeda's vaccine. क्यों देंगा? So I'll just
Student.
want to make a Hindi Q&A parent FAQ generator, and you see डॉक्टर साहब बच्चे को तेज बुखार है, शायद वायरल होगा, आराम हो जाएगा, बरसात के मौसम में डेंगू की जांच भी जरूरी होती है. सो दिस इज सिंपल क्वेश्चंस which is given by this. If I select the other GPT, which will actually, this is I'm using for the IAP, and in this I just give a dengue fever prompt. The advantage of this thing is it is going to create a image without
Yeah.
saying anything,
Yeah.
because all the custom instructions are been given. And that's why if you see the people who are using the chat GPT are not using that as a chat GPT, they are using that as a custom GPTs. Those who don't have access to custom GPTs because they are using a free account, for them also the projects is there. I mean, everything can be done. I do, if you see the PG thesis, the AOPG e-Gurukul design, you must be receiving the AOPG Gurukul brochures, and that has been done by my this one custom GPT only. So always project and custom GPTs, both things are a better way, a better scientific way by which you can save your time. But once you have to give proper time so that all the instructions are been perfect. So that is most important thing. And you see this IAP care dengue fever. Now
Lovely.
okay, because the last thing which I made was of a Dr. Elizabeth. The directly name of Elizabeth is also been taken. Okay, IAP President Action Plan under the visionary leadership of Dr. Neelam Mohan. Okay, so this saves so much of your time. Only thing is, I forgot that while creating this GPT, I've given this to IAP people. Now they are using, I'm not using. You have to add three things: a name of the topic, name of the expert, and a key take home message which you want to give. And accordingly, see, because the dengue fever is there, you see the water which should not be like this. The shield is there, a high fever, headache, timely testing, and removing the stagnant water is the things. So prevent, protect, and protect. The mosquito is also been there, though no instruction was given, but a custom GPT prompt has been prepared in such a way. So thank you so much once again to Deepak for me to
Dr.
present.
Kariya, there is a Dr. Pratima was waiting for a long time. She was raised her hand. Madam,
Yeah.
can you unmute and ask if you are there?
Yeah, thank you, sir. Thank you. No, sir. When we are doing that custom GPT discharge summary, sir given such a long prompt, like, for many, almost like a dictating letter to your intern or PG. So if we had already files in the EMR system daily notes, so custom GPT, it won't take from that files to make the discharge summary, sir.
It will take, you have to just do one thing, that say for example, when you are using it, what you have to do is simply that while you are just making a discharge summary, at that time, if you just see, I'll just show you that in a discharge summary, there is an option which was there. Over here, there is a button of plus. Can you see, ma'am? See my arrow?
I can see.
Yeah. When you click on plus button, add files and more. So over here, from your computer, you can just add the PDFs or photos or from your EMR and attach over here.
Sir.
Just attach over here the things. Then whatever I was speaking, you don't need to speak it also, because everything is there on paper. It will take it and directly you just enter and the discharge summary will be ready.
Yeah, then after finishing the summaries, usually we'll take it from EMR, the files. We are going to keep it in our custom, right?
Yeah.
So after doing that, how to delete those files from our, custom GPT, sir? We don't want to dump all the files which in day to day,
And if
right?
you see Dr. Bhavnagar NICU is a custom GPT. Same way, any GPT which you have seen are actually opens with a blank only. This shows how many times this GPT was being used. If you see the Facebook of feedback of 360 AI, that was used 90 times. If you see pediatric OPD scribe, it was used 40 times. Okay, same way, if you see the others, I mean, how many times different GPTs are being used, then this caricature like Dr. Prashant has been used 200 times. But when I open this caricature, okay, so at that time it opens as a blank only. There is no memory of this. You have to actually, copy paste from here. Say, for example, this caricature Narendra Modi. I'm just saying this, copying this, his image.
Okay.
And when I'm entering into my this caricature command, I'm not giving any command. Okay.
Okay.
Or let's say Dr. Narendra Modi.
Okay. It's not going to be memorized. It's going to be like
Yeah,
more or
it will
less.
be
Yeah.
deleted. Or I mean, once I
Yeah.
open it again, it will be deleted. But
Okay.
once the output is there, whatever output is there, if I want to save it, I have to either save it in a different Word file or a PDF file. That will be better for me. And that is the advantage, so that you don't have a rupture of everything. Say, for example, you are daily discharging 10 patients and all this.
Yeah, that's what. Yes.
So, but the disadvantage is again, you will have to do it again and again, the same thing.
Pratima, always whenever you're using this generalized LLM, go to settings and you make the setup whatever you want. You can customize regarding the memory of whatever the prompts you are given. You can customize it.
Okay. Okay.
The settings, yeah.
Settings,
See, so
which,
many options are there. You can personalize it.
Okay.
Okay.
and every time, I mean, there are certain settings which should be done, and one of that is a data control. I usually keep it off. Improve the model for everyone. I just keep it off because whatever data you are entering will be actually being taken by a GPTs. But then if it is improving model for everyone, sometimes by mistake, if you enter a sensitive data, that can be a problem. So keep it off. Location should be turned off. So this things should be there, which is there. Okay. And now you see, with just a simple prompt, he made Mr. Narendra Modi as a doctor and a pediatrician only, because this is a caricature request in which I say that it should be as a pediatrician only. But the good thing which these GPTs are doing, see, Seva Samarpan Sanskar for the nation, for the children, and a BJP logo is also been there, which was not told to this GPT. But because everybody knows and everybody has done research about Mr. Narendra Modi so much that directly this also comes into your custom GPT, even if the prompt was not there to have this type of logo and sentences. Yeah, thank you so much.
Dr. Prashant, your caricature GPT already all these learners are used
Yeah,
for the
that's what I
books.
think.
They posted in the, because I just showed them how their bios will appear.
Yeah.
So I gave the regular professional one and caricature one, and most
Yeah.
of them have done.
Yeah.
So
But
I think
all these things are been made, Deepak, with a simple prompt that
yeah,
please, I want to have this, and then this custom GPT was been made. So initially when I was making custom GPT, it was like it is very difficult. But then once you regularly are doing it, then it is very easy.
I think today's we have completed almost 2 hours long sessions. I think more of a hands-on demo. I should thank our speakers, Dr. Harsh, in spite of his very bad throat, he could able to deliver the optimum output to you. And also I should thank Dr. Prashant Kariya, even though he was busy with this another online sessions. So I should thank on behalf of Smart Hill Nexus Academy and this Perceptron group. Any further discussions, I will add them into this Perceptron group. They will be there till next month, 15th, till our weeks get over. I think if there is any doubt, there is no doubt. I think we'll make it a day. Tomorrow, I'm going to send you the recordings. So thanks once again, Dr. Prashant and Dr. Harsh. And thanks everyone because you all stayed till 11 o'clock. Thank you very much. Good night. Good night.
Right.
Please do some box breathing. Yeah. Thank you, Minath sir. Thank you.
At least we know how to go about the custom GPT, then we'll work on it. Prompt and
I think Dr. Minaj, if you take that Chat GPT Plus now, you can upload up to 5-6 books also. That you have to check it. Chat GPT Plus. It's like enterprise version.
I have Pro plan.
No, Go plan में ऐसा नहीं होता. 500 MB is the maximum. So if you want to do exclusive, take an enterprise version from your hospital or college, and you can use still in a more deeper way. Just I will check it and tell you.
Yes, sir. Yes.
Right.
So far, I paid Claude and this thing. Claude, ChatGPT, and
Claude, you can do projects. It's very good.
Yeah.
So once you are addicted to Claude, no, only for images you will come to ChatGPT.
Claude
Okay.
is really good.
Yeah.
I am preparing
Prashant is laughing. Yeah. Yeah.
I am preparing a PPT, sir, in one format. That what is that format? I'll show you. PPT JS format.
Okay.
Very good format. PPT JS format.
Yeah.
So it is coming up nicely. So what I do, all these things I put over there. It's just say that format, it will come in that. Very good PPT is coming up.
Yeah. You can integrate. So thank you very much, Dr. Devapriya and all seniors. Thanks a lot. Good night.
Night.
Have a nice.
See you nice. Thank you, sir.
Thank you. Bye.
Good night.
Bye.
Well thought. Well thought.
Bye.